All right, greetings. Thanks for joining me. What we're going to be doing today is how and why to use a concept map, how it is going to help you throughout your nursing education. Okay. It doesn't matter if you're doing LPN, RN, ADN, NP, but the disease processes and or nursing concept remains the same. What happens is the depth or the level that you um, evolve or learn about the process, the disease process, what what goes with it, how does it make sense clinically, objectively, subjectively, what can you look at to recognize signs and symptoms in your patient that correlate with how you're going to use the nursing process. For example, you have, let's do in this topic, in this video, we're going to discuss how to do a nursing concept map, which is essentially a brainstorming page. Okay, you see the word pathophysiology. This relates to the changes that the body goes through during the disease process, aka the nursing concept. You can apply this in a very creative format. For example, what you see here on this board that I'm going to sharing is you see in the middle, it says disease. And then the arrows that point to certain boxes that has names with it, right? Risk factors, pathogenesis, clinical manifestations, diagnoses or diagnoses, treatments, and etiology. Etiology means how did it happen? What's the cause? Okay, so let's do an example here. I'm going to do the example of UTI, and I'm going to write in there urinary tract infection. Okay, simple, done. You move to the next box. The next box would come in here. Now, you need to use your textbook for this. Utilizing search engines online really don't do you a service. Um, Utilizing your spirit of inquiry by grabbing your assigned textbook will help you. So if we're going for a urinary tract infection as our nursing disease process or our nursing concept, typically you want to have a book to reference. Okay. So we need to know, let's start with, let's move the box to etiology, right? What is the etiology of a urinary tract infection? Yes, here. Let's do the text box here. Fecal entry to urinary meatus. Okay, that's one way a patient could get a UTI, a urinary tract infection. What's another way? Right? Let's talk about it. Brainstorming right now. Right? How about dehydration? Maybe another way. Um, let's see. Catheterization from getting a Foley catheter input in by nursing staff, right? They're at risk for a CAUTI, catheter associated urinary tract infection. And that's just to name a few. The etiologies can go on as long as you want them to. So this gives you an example on etiology, meaning how did this happen? Risk factors. Well, older women, okay, or older men, older women in this case, regarding maybe they'll have bladder spasms. Okay, what else? Let's continue on. What about pregnant women? Let's not forget about the men here, men with BPH. We'll have to look that up to understand it. Benign prostatic hypertrophy. Okay, what about immunocompromise? Immunosuppression, right? The immune system, the white blood cells, neutrophils included, macrophages, they can't come in and fight off the predators inside the body because they're on maybe a chemo, radiation therapy, chemotherapy, some sort of immunosuppression, right? Um, patients with diabetes, so on and so forth, most common risk factors. And again, you get this out of your book. I'm utilizing right now the HESI book. It's a wonderful book to utilize for concepts. You can also use Saunders NCLEX. You can also use your other assigned books that have been assigned to you for this, right? So PNR 104, your fundamentals, right? What about this one for PNR 206? All those concepts, those are important. Pathogenesis, well, that's what's going on in the body on a cellular level, right? So let's look at maybe elevated white blood cell, right? Pain at CVA or the costovertebral angle, right? It goes on, etc., etc., so on and so forth. You can break it down like that. Okay. Again, I'm not filling it out entirely, but this is for you to utilize your spirit of inquiry as a student and come in here and try to learn a little bit more about what you want to do with your profession, with your life here, right? We're dedicating our time to the care of other people, so we need to know all about it. How do you treat a UTI? Well, I know that Bactrim is one of them, right? Over-the-counter drugs such as AZO, fluid, electrolyte replacement. What else? Maybe removal of a Foley catheter, if applicable, right? If the doctor says yes, that's when you collaborate. Well, how else are you gonna treat them here? So on and so forth. Avoid alcohol, right? Proper blood glucose management. This ties on to the nursing process. And for the concept map here, like we're doing the brainstorming page, you don't have to use all of these boxes. You can use all of them and then some. Like you can add in nursing interventions at one under, maybe under the treatment, right? You can add in nursing diagnosis under the diagnosis portion down here. You can evaluate, maybe branch off clinical manifestations, branch off another box that says evaluation, right? Patient remaining free of dysuria, okay? We're gonna make you can make an extra box here from teaching, make an extra box that says education, meaning teaching the patient to wipe from front to back, not back to front. If we wipe back to front, of course, you paint the picture of what's going to happen. Literally, you're painting the picture with fecal matter as the, okay? Don't do that. That'll give you a UTI. How about tell the patients to take their prescriptions as ordered, right? Don't just say, oh, 3 days, I'm good. No, follow the order, right? Void every 2 to 3 hours. Don't hold your urine, right? Hydrate, 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 okay? You definitely need at least 2 liters of fluids unless indicated, right, by a medical professional. Wear cotton underwear, breathable undergarments, right? If we're sweating, if it's hot, if it's damp, you're going to create a UTI no matter what, male or female, more so females, okay? Women, right? You can put here for treatment as well, educate women on not taking baths because baths can lead to irritation and infection. If we are irritated by a certain soap or allergen that's in the soap, we can create a concoction for a UTI, right? And how do they diagnose it? Well, you can come down here in the diagnosis tab and you're going to put here clean catch urine sample. You can even put a note to yourself to know what a normal urinalysis looks like. And that can be a whole concept map here to where urinalysis would then be in the center of the brainstorming page. And you would actually write down what a normal UA looks like or a urine analysis. Okay. They also look at the white blood cells of the body. Okay. Clinical manifestations, you can come over here. You may want to watch for incontinent patients, right? Because if they remain wet, damp, dark regions are a breeding ground for bacteria to just run amok, and amok. Okay, meaning they're going to need some antibiotics. You're going to see an increase in your white blood cells. And if you got a patient this is happening to and they're a cancer patient, well, you better be very careful if they're immunosuppressed. Okay. Hand washing, right? Hand washing is another treatment that they can do. They need to wash their hands as well as far as us. Let's see, what other clinical manifestations? Well, hematuria or blood in the urine, dysuria, burning while peeing. Okay, those are problematic. Changes in urine color or odor, those could signify a UTI, right? Discharge for male and female, if the consistency changes, males should not have discharge. So if they have discharge, that's an alert right there. Okay. How about frequency and urgency, right? All of a sudden your little old lady in room 112, she's now getting up like every 20 minutes to just dribble, drabble a little bit of urine. That's might be causative for a UTI, right? Urgency, frequency, how often, urgency, how bad is the urge to go, right? Males, they'll have difficulty starting a stream, or females, etc., etc. I mean, the list goes on. Okay. Normally males, you'll see an obstruction where it shows difficulty starting a stream, but if they're experiencing burning, then it may be difficult for them to start as well. So you have to watch now. Are we looking at a UTI and with the stone, or are we looking at just a UTI? So males, you have to be extra cautious in that sense. Okay. Again, I didn't fill this out entirely. This is just a short and sweet video how to fill out a brainstorming and or concept map page. Okay. You can utilize whatever format that you feel necessary. Start with these items here and then branch off into the nursing process. Don't forget about the nursing process because those relate to questions on your exams that say the nurse would anticipate what? The nurse may want to caution what, you know? So you just want to be mindful. Teaching, right? You can add on here teaching, like I said, delegation. What can you delegate? Don't delegate what you can't eat, right? Evaluate, assess, or teach. So you can branch off to these boxes. Again, don't do less, add more. When you're reading and sitting down reading a book for whatever, let's say it's chapter 19 of your book, whatever book, and that's what you've been assigned to, then how do you pick out nursing concepts? They're normally concepts that are in bold, capitalized print, okay? They normally have a different color font. They might even be a vocabulary word in your textbook, no matter what textbook. Again, Nursing concepts don't change over degree levels. What will change is the depth of knowledge that you are required to know. Okay. Medical terminology. If you have to create a brainstorming or a concept map, which is what I have on the screen here, then you do so. But I also want to show you something else here for no matter what course in nursing that you're in. I'm going to try to share the screen. Let's see how this goes. Let's see here. Share the screen. Try this. Close whiteboard. Okay, so let's try that. Let's do screen sharing. Yes. Okay. Okay, so now we're here on your Canvas dashboard. Now, no matter what you got going on, right, it shouldn't matter. I'm going to just, for example, I'm going to get into, let's go to NUR 210. Okay, I'm going to enter my tile. And I'm going to go to my modules tab. And again, doesn't matter what course that you're in. You're going to go to student resources. Just want to show you this. And you're going to find the fundamentals book. So let me take a peek here. Clinical sales, more so medical surgical and or fundamental. So let's go to the right here, fundamentals of nursing. Whether you're in the first LPN course, PNR 104, or you're in the last RN course, you go to your reference packages and you want to find the Perry and Potter Fundamentals of Nursing book. Click on that. Load the link by clicking the gray bar. And now I want you to see, you can see print and audio is here for you. I'm just going to randomly pick a chapter. Let's go to chapter 50, perioperative. And again, just an example on how you're going to find this. What you have here, wow, a concept map creator. And another thing, a conceptual concept map creator. This is your care plan in an electronic format. This is your concept map, okay? You also have videos in here. I suggested if you're studying effectively, you're going to figure out what type of learner you are: visual, audio, audio visual. If you like to read, now's the time to identify how you learn the best. So videos, if they're going to help you, watch them. Let's go into Concept Map Creator. You're just going to click on it. Give it a second. Wow, now we're in, basically it took you to the Evolve. You hit next. Okay, it's going to tell you how to do it. Here we go. If I were to type a medical diagnosis of UTI, which we just did, and then the patho, right? What's going on in the blood serum, right? So elevated white blood count, so on and so forth, right? Are we going to see cast in urine? Possibly, right? What else? Are we going to see bacteria in the UA? Or urinalysis, right? So on and so forth. And you can come over here, risk factors, incontinence, right? Elderly, etc., etc. You continue to fill it out, and then you hit next. Okay. Now clinical. What are we going to see? We're going to see possibly dysuria, hematuria, right? What else are you going to see? Fever, chills, typical signs and symptoms of infection. You can add another manifestation. You can delete a manifestation. Now the nursing diagnoses, right? Look at here at the key. The diamond is your nursing diagnosis. You would click the blue diamond, and the circle is the collaboration. Let's go to nursing, click on that, and you hit a drop down box. Wow, bowel incontinence, right? Because if they're incontinence of bowel and it's getting into the urinary meatus, it's traveling through the fecal matter right up the meatus to, to the ureters, up to the bladder, then we're at risk for pyelonephritis because it might reach the kidneys, and that's an issue. What about collaborative problems? Hit that. And then you can type in whatever you think, right? If they need to go down to a procedure, okay, you can write that down, and then you hit next. Expected outcome. Wow, that sounds like evaluation. Patient will be free of dysuria within the next 72 hours, right? Nursing interventions. We're going to aid the patient to void more frequently, right? Maybe their UTI is caused by them holding their urine. Whatever interventions you're going to do, provide hydration. And you can put maybe, Q 1 hour or Q 2 hours, whatever that you think, etc. The list goes on. You create your brainstorming page, your concept map. Hit next. Now, you've got some options here. Create it, save it, or save your data. If you got a USB, like a little jump drive, USB drive, right? You want to start saving this, okay? And if you're not sure what to do, take a breath and read, okay? It says here, by clicking Create Map, a new browser will open that displays your concept map. Let's take a peek, okay? Boom. Wow, now we've got this made. Well, it's going to look better when you actually do it. It's got keys down here, and you'll be able to save it, excuse me, from this area, okay? If I were to save the map, again, it'll pop up a box at the bottom, and it will save it as a PDF, which is fabulous because then you can add this and organize your digital life as a student in a folder that says urinary or GU, okay, whatever that you feel that how you want to organize it, okay? So that's one. Let's go back here to the options we had. I want to show you now the conceptual care map creator, right? Now here is where you can create after clinicals. Your browser must allow Java. Have mercy, I gotta do Java. Okay, well, here we go, here we go. Okay. All right, I've done some playing with this beforehand. Now, what you want to do here, if you're going to create a care plan time, you're going to create map name. Don't put your patient's name. That's going to break HIPAA. You can just put here if it's patient day 1, meaning your first day at clinical. That's going to clue you, say, oh, that's what I was assigned on my first day. Great. So you're going to come here and fill out your name. Fortis student, right? Your name, your patient initials, room number, admission date. Now these are the things that when you go to clinicals with your instructor, you're going to be responsible for getting. You have your lab values up here, right? This is part of your Chem 7. This is part of your fishbone. You haven't been shown these yet, I'm sure, but we will show you these. But if not, please research I'll do another video, the Chem 7 and the CBC, the fishbone CBC as well, because this is a way, if you've got one of those cute little clipboards from Amazon that are like on the back, you open the clipboard on the back, it has all these like weird lines and lab values. Those are called fishbones. It's literally on the back of those can't even think, the the clipboards, and that'll help you too. And again, I'll put out some different information, but it says right here, BMP. Don't freak out. There's your BMP. Find in your Mosby's lab manual, find in your HESI book, NCLEX book, or your textbook. Hey, what goes in a BMP? What's in a CBC? Well, we know white counts in a CBC, right? Your normal white count, it says here, right? Is it elevated? You can click on this. Is it normal? So if the, let's say, for example, your patient with a UTI, their white count result is 17. You and your instructor went into the computer at clinical and said, hey, it's 17. Well, come down here. Is it normal? Is it elevated? That's elevated, arrow up, okay? And so on and so forth with the BMP. You can fill this in down here. But let's go back up here. So we're going to fill out admission date. Let's say 11/1. Code status. Are they a DNR? Are they a full code? And today's date is 11/2. Their age, right? 99. Gender, male, female. Weight, right? You can come up in here and put in 128 kilograms. You guys should be learning metric, right? Height is going to be in inches. Let's just say 65 inches. Braden scale, what they scored for their skin assessment, right? How are we going to do that? What's in here? Diet. Let's see. Heart healthy diet, less than 2 grams sodium Q day. Boom. Activity assist times 3. We need 3 people to get them up. Religion. You fill that out. Okay. Let's just say if they're Baptist, this for this example, I'm gonna do allergies, codeine, shellfish, right? PCN, penicillins, right? Cautious with cephalosporin, admitting diagnosis, UTI. Okay. Assessment data. You can come in here and go and utilize the sheets that we give you at clinical with how to document certain verbiage. Like, okay, so if you start with the head, and you can do however you want. Scalp free of breakdown, lesions, open wounds, right? Alopecia noted to left, posterior oh, okay, right, or posterior head, etc. You go on, then you go down to eyes, ear, you see when bows, all down, head to toe, you write in whatever you want. Let's say fluids, they got LR going at 125 mLs per hour, right? Continuous, okay? IV site, left AC, right? You write that down, 18 gauge. Past medical history, you better have taken a lot of notes here, right? What if they had a history of C-section times 3? What if they had tumor removal or cold laparoscopic cholecystectomy? Don't know if I'm spelling that right. Right, bowel resection of transverse bowel resection, however you want to write that. Whatever their history is, you add it in here. You get what I'm saying here. Medications, know their meds. What are they on? Well, they take clopidogrel, spelling it wrong, I'm sure. 75 milligrams Q 24 hours, whatever the order is, right? Q day or once per day. What if they're on metformin, right? What are they on? 500 milligrams per day. What about losartan? Whatever they're on, you see what I'm saying here, 160 milligrams, okay, etc., etc. You keep writing it, okay? Primary nursing diagnosis. right? Is it impaired tissue integrity, etc.? You keep going down, supporting data, evidence by, that's your key verbiage, okay? um, Interventions, what you did for it, evidence-based practice, Q2 terms, what did you do for it? And then your evaluation. Any additional information you want to add can go down here. Let's go back up to treatments, right? Did they get a UA, a urinary analysis? What did they get? Did we strain the urine for stones? What did we do? Okay, what the doc order? And then once you're all done filling this in, you can save to a PDF format. And then now you can print it and turn it into your clinical instructor. They're going to love it because they don't have to discern different penmanship styles. It's all one single format. Okay, if they don't want you to use this, that's okay. You utilize what they give you. All right, but there's only two options here. It's either what your instructor provides or this. This is a wonderful tool, okay, because it's electronic, as we should be moving and stop killing all these trees. That's just my opinion, though. All right, I'm going to stop sharing the screen now, reel it back in. I hope this helps you, one, create a care plan and understand how to create a concept map to help you in the future. All right. Thanks for watching.